Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How long can you wait to take Plan B and it still be effective? Plan B OneStep, Levonorgestrel, used for emergency contraception, is most effective when taken as soon as possible after unprotected sex or birth control failure. However, it can be effective for up to 3 days, 72 hours, and sometimes up to 5 days. /r/n/r/n Plan B decreases the chance of unintended pregnancy. It is available over the counter, OTC, at pharmacies, family planning clinics, or health department clinics. You do not need a prescription or identification to get Plan B OneStep, and people of any age or gender may buy it. /r/n/r/n Plan B is not the same thing as the abortion pill, mifepristone, also known as RU486, sold under the brand name Mifeprex. /r/n/r/n This article will discuss when you should take Plan B to optimize its effectiveness, how it works to prevent pregnancy, the cost, and other important information. /r/n/r/n Plan B OneStep is a hormonal drug taken by mouth that contains 1.5 milligrams of Levonorgestrel. Levonorgestrel, used for many years in birth control pills and hormonal intrauterine devices, IUDs, works by preventing the release of an egg from the ovary, called ovulation. /r/n/r/n Plan B OneStep works by blocking the surge of a luteinizing hormone, LH, that triggers ovulation. If you have not yet ovulated, stopping this process can protect against pregnancy. /r/n/r/n Peak concentrations of Levonorgestrel are reached in the blood within 1 to 2 hours of a dose. Thereafter, Plan B can continue to prevent LH surges for 4 to 5 days. /r/n/r/n This is the same time frame during which sperm are still viable. Sperm can survive in the female reproductive tract and be capable of fertilizing an egg for 4 to 5 days. After 6 days, the ability of sperm to conceive pregnancy drops to less than 1%. /r/n/r/n Plan B OneStep does not work if you have already ovulated. /r/n/r/n Despite misconceptions that Plan B can prevent implantation of a fertilized egg, prevent sperm from entering the egg, or change cervical mucus to prevent sperm from reaching the egg, no such benefits have been found. /r/n/r/n While Plan B OneStep may be able to prevent ovulation for up to 5 days, the level of protection decreases as the drug is gradually eliminated from the body. /r/n/r/n Levonorgestrel has a relatively long half-life, meaning the time during which half of the drug is eliminated from the body, but it is more effective during the earlier part of treatment when drug concentrations are high than the tail end when drug concentrations are reduced. /r/n/r/n At the same time, the half-life of Levonorgestrel can vary, ranging from 20 hours to 60 hours. For people at a healthy weight, Levonorgestrel has an average half-life of up to 46.4 hours. In contrast, Levonorgestrel has a half-life of 26.4 hours. In people with obesity, /r/n/r/n This doesn't mean that Plan B is less effective if you are overweight. It only highlights the need to take the drug as early as possible to improve your odds of protection. /r/n/r/n Plan B OneStep is estimated to be 75% to 89% effective if taken within 3 days of unprotected sex. The sooner it is taken, the more effective it is. /r/n/r/n It may also be effective, just not as effective when taken 4 to 5 days after unprotected sex. /r/n/r/n While Plan B OneStep is commonly called the morning after pill, you do not have to wait until the next morning to take it. Experts recommend keeping a box on hand so that you can take it if a condom fails or is not used. /r/n/r/n After taking emergency contraception, you should use barrier protection, such as a condom, and your regular birth control method for at least 7 days if you have sexual intercourse. /r/n/r/n emergency contraception does not affect future fertility or any future chances of getting pregnant. This includes emergency contraceptive pills like Plan B as well as copper-containing intrauterine devices, IUDs, which can also be used for emergency contraception. /r/n/r/n certain drugs may interact with Plan B OneStep, making it less effective. These include /r/n/r/n. If you take any of these drugs, ask your healthcare provider if it is reasonable to interrupt treatment for several days. Do not stop unless your provider gives you the okay. With some of these drugs, stopping can lead to withdrawal symptoms, drug resistance, or treatment failure. /r/n/r/n You should also not take Plan B OneStep, or any Levonorgestrel-based drug, if you have taken the emergency contraceptive mifepristone, in the past 5 days. Taking them this close together can counteract their effects and cause them to fail. /r/n/r/n As with all drugs, Plan B OneStep can cause side effects. Some of the more common include, /r/n/r/n If you vomit within 2 hours of a dose, contact your healthcare provider to see if you should repeat the dose. /r/n/r/n Do not take more than 1 dose of Plan B. Taking more will not make the drug more effective and may only serve to increase the risk of side effects. /r/n/r/n While it is common for your period to be temporarily lighter, heavier, or different after taking Plan B, it shouldn't altogether cease. If you don't get your period within 3 weeks of using Plan B, take a pregnancy test to see if you are, in fact, pregnant. /r/n/r/n Plan B OneStep is indicated for any situation where you may be at risk of unintended pregnancy following sex, including, /r/n/r/n Plan B OneStep is only used to prevent pregnancy after unprotected sex. It does not protect against sexually transmitted infections, STIs, like HIV. /r/n/r/n In addition, Plan B OneStep should not be used if, /r/n/r/n anyone of any age or gender can buy Plan B OneStep without a prescription. Identification is not required. /r/n/r/n You can find Plan B OneStep, or generic versions of the drug, at /r/n/r/n You can purchase Plan B OneStep for about $40 to $50. There are generic versions that cost between $11 and $45, including Take Action, My Way, Option 2, Preventiza, After Pill, My Choice, Aftera, and eContra. /r/n/r/n You can also check with your Planned Parenthood Center, Family Planning Clinic, or Municipal Health Department to see if you can get Plan B at a lower cost or for free. /r/n/r/n Many Medicaid and private insurance plans cover Plan B with no co-pay. However, you will need to get it prescribed by a healthcare provider in order for the drug to be covered. /r/n/r/n Plan B OneStep, Levonorgestrel, is an emergency contraceptive used to prevent pregnancy following unprotected sex or birth control failure. It should be taken as soon as possible, ideally within 3 days, and possibly up to 5 days. /r/n/r/n Plan B works by preventing ovulation. Side effects include irregular periods, spotting, nausea, and breast pain. Plan B can be purchased online, in drugstores, or in family planning clinics without a prescription. You can buy it irrespective of age or gender and do not need identification. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.